Dermatology. All right, so to start off dermatology, we're going to talk about the skin layers as well as epithelial cell junctions. Now, for dermatology, once again, you're going to be probably struggling with the questions in UWorld because it's a whole different type of world, but thankfully it's not too high yield, once again. We're going to focus in on the common dermatological pathologies in this next chapter, and hopefully I'll get you through the UWorld chapters and get you some of those extra questions that might pop up on your Step 1 exam or CBSE. All right, so first we have the dermatological layers. This is just the skin layers. So there's three types of layers. You have the epidermis, the dermis, and subcutaneous fat, which is known as the hypodermis. And the epidermis is made up of 5 certain layers: the stratum corneum, stratum lucidium, stratum granulosum, stratum spinosum, and finally the stratum basale. You should know where each one is located. You should know the order in which they're located, and you should know how they look like on histology. It's very important. They could point out at different structures, different locations, and that's pretty much what they want you to know. Okay, now those skin layers of the epidermis are going to be located pretty much in every single portion of your skin, except for in the thin layers of your skin, you do not have the stratum lucidium. Okay, so that's just out of there. Now, let's talk about the epithelial cell junctions. So first we have the tight junction. So this is going to go from the top outermost down to the basement membrane. So outermost apical portion, we have the tight junctions. Okay, this is known as zonula occludens. Okay, and this prevents paracellular movement of solutes. So this does not allow solutes to travel between cells. Okay, so you can't go between one cell and another cell because it's connected by a tight junction. Next is going to be adherens junctions, which is belt desmosome. Is another name for it, or zonula adherens is another name for it. And it just forms a belt connecting actin cytoskeletons, okay, of adjacent cells. So whenever we say like cadherens, this is where cadherens are made up of, okay? And remember, when we have loss of E cadherin, that helps promote metastasis in any cancer. So loss of this layer of the adherens junctions is going to be the loss of E cadherens, which promotes metastases. Okay, so anytime you see a loss in E cadherens, start thinking about cancer, okay, and metastasis. Next is going to be desmosomes, also known as spot desmosomes or macula adherens. This is going to be just support once again, and there's a high yield pathology associated with desmosomes. I want you to know that if we have autoantibodies against desmoglein, which is just like a portion or a part of the desmosome, it's going to lead to pemphigus vulgaris, and we'll get to that later on, but it's just important to talk about here now. Next is our gap junctions. Our gap junctions are essentially channels that are made up of connexins, and they help with electrical and chemical communication between cells. So it allows for the inside of each cell to communicate with another cell, okay? And on the bottom, we have the hemidesmosomes. The hemidesmosomes connects the keratin and the basal cells to underlying basement membrane. So this connects or kind of anchors our basement membrane to the cell. Now, another pathology associated with this, if you have autoantibodies against this, it could lead to bullous pemphigoid. So bullous pemphigoid is associated with hemidesmosomes, autoantibodies against them, okay? Now, the last thing is integrins. Integrins are membrane proteins that maintain the integrity of the basolateral membrane. So what they do is they bind collagen, laminin, and fibronectin in the basement membrane, okay? So overall, these are not that high yield, but I just want to talk to you about them just so you fully understand what's going on. Next is going to be our dermatological macroscopic terms, okay? So this video is just going to kind of be an overview of dermatology so you can kind of see what we're talking about when we get to the pathologies. Macules are just flat lesions, okay? That are less than 1 centimeter. Patches are just flat lesions that are greater than 1 centimeter, okay? They're well circumscribed usually, and they change the skin color. There's usually a change in skin color. Papules and plaques are elevated solid skin lesions that are less than 1 centimeter and greater than 1 centimeter, okay? So it's the same as macules and patches, but they're elevated, all right? So papules are less than 1 centimeter, plaques are greater than 1 centimeter of elevated solid skin lesion. Next is going to be vesicles and bulla. Vesicles are small fluids containing blisters less than 1 centimeter, and bulla are large fluid containing blisters greater than 1 centimeter, okay? Pustules contain pus, hence the name. You'll see wheals, which is transient smooth papules or plaques. This is seen in hives or urticaria. And then you have scales, which are flaking off of the stratum corneum, and then crusts, which is dry exudates. Okay, once again, you don't have to memorize all this, but I'm just saying it so you fully understand the characteristics of what we're going to discuss later on, okay? Lastly is dermatological microscopic terms before we get into the pathologies. What you need to know, these are actually important because each one of these kind of has an association with a pathology, and we'll discuss it later on. First, we have dyskeratosis, which is abnormal premature keratinization, Okay, so abnormal premature keratinization. And it's seen in squamous cell carcinoma. So that's dyskeratosis. Next, we have hyperkeratosis, which is increased thickness of the stratum corneum. That's going to be seen in psoriasis and calluses, but psoriasis is key. Next is parakeratosis, which is retention of nuclei in the stratum corneum, and that's also seen in psoriasis as well as actinic keratoses. Next is going to be hypergranulosis. Hypergranulosis is increased thickness of the stratum granulosum. So you have hyperkeratosis, which is increased thickness of the stratum corneum, and then you have hypergranulosis, which is increased thickness of the stratum granulosum. Hypergranulosis is going to be associated with lichen planus, which is very high yield to know as well. We'll talk about these later on. Next is spongiosis. This is epidermal accumulation of edematous fluid in the intracellular spaces. Spongiosis is a perfect name because it reminds me of a sponge which accumulates fluid, right? So same thing. And it's seen in eczematous dermatitis or contact dermatitis, okay? Acantholysis is going to be separation of the epidural cells seen in pemphigus vulgaris. And acanthosis is epidural hyperplasia, specifically of the increase in the spinosum. And this is seen in acanthosis nigricans and psoriasis. Lastly, chronic corticosteroid usage causes dermal atrophy, which is also something that they'll ask about. Okay, so these are our dermatological microscopic terms. They are very high yield. If I were to do anything, I would maybe just like memorize those and what the characteristics are, and you can memorize it with like the examples because those are high yield, or you could just wait to kind of learn the pathologies and their association. But if I were to do anything for dermatology, I think that this would probably be the most helpful in learning everything else.